So before we continue, in a nutshell, infertility, we do investigations for the man, sperm analysis, very easy. Test for ovulation, all this hormonal test with ultrasound scan, HSG to see the tubes are open, or we can do laparoscopy and dye test. Remember, I said that if your period is irregular, you do day 21, what should you do? Irregular periods come in two forms for people, not for doctors now, for our viewers. It's either your periods, they are so irregular that you don't even know when they will start. One last month, one in 4 months' time, one in 6 months' time. If you're having a irregular period, it's difficult to know your day 21. Or if you're having no period at all, entirely stopped, what do? We can give some medications to you to make you have withdrawal bleed, and they will start counting day 21. Or you just know whenever you bleed, start counting 21 days, and you do your test. Now, it's paramount that I use the opportunity to tell people that our ladies must do cervical smear test. If you're less than 60 years old, do it every three years. Cervical smear is we examine you on your vagina, and there is this opening of your womb called the cervix. We take cells there. It's not painful at all, very easy. Cells there, like a sample there, every 3 years to check for any abnormality that could suggest that person is having signs of any cancer. Cervical cancer is highly preventable, and it can be screened for and tracked, known, and treated even before it starts. So cervical smear is also called pap smear in some part of the world, maybe in America or in some part of Europe. They call it a pap smear, Papa Nicolau smear, or cervical smear. It's all the same thing. We call it cervical smear in UK. It's all the same thing. Do it every 3 years. And if you're on maybe dialysis, renal transplant, you got maybe issue of HIV, you do it every 6 months. And yeah, every 6 months, yeah. Because that can cause irregular bleeding. Now, what can cause blockage in the tubes? Number one, like I said again, infection, chlamydia, gonorrhea, all these funny infections, and so on and so forth. If you see one infection, the other one is there. They come with their brother and cousin. They don't come alone. Infection, they come with their family, grandfather, and ancestors. When you see one, look for the other one. That's number one. If you're having offensive discharge or pain on both sides of your tummy, okay, or pain during your period, or bleeding during sex, check for vaginal infection. Number two, what can cause blockage in tubes is endometriosis. Endometriosis is basically, if I bring this womb closer to my screen, you see some black spots behind this womb here. See those black spots there? That is endometriosis. And what are they? Okay, so I'll bring it closer to my viewers here. You can see all those black spots behind the womb there. Those black spots here and there. Okay. Now you can bring the camera back again to our viewers. That is endometriosis. That is endometriosis. How did they get there? We don't know. But what are they? They are the cells that line the womb cavity. See, this womb cavity is cut open. There are 3 entire layers. The one inside that is pink as my lips, the red one that is the muscle block of the womb, and that brown one outside here. This is the mucosal layer, the myometrial layer, and this is the subserosal layer. You can have fibroids anywhere, but these cells inside that are pink as my lips is the one that bleeds every month during your cycle. For some reason, some of them will find their way outside the womb and go and implant on this outside here. You see them there. And these ones here outside, they are just like their own friends or cousins inside the womb. They can't bleed out. Some of them can be so bad, they can go and get stuck to your ovary or to your tubes, and they make the tubes damaged, and the tubes cannot open freely to catch the eggs. Endometriosis can affect the tubes, can affect the ovaries, can affect an implant on the bowels, on the intestine, or even on the back of the womb. But they will stretch at any point you're having period, and they will shrink after your period is gone. That is if you are having pain, very, very common and getting worse as your period progresses. Around your period time, you're having pain around your period time. The pain is so bad, it could be from endometriosis, and the pain will get worse with each subsequent periods. This pain gets worse. That is endometriosis. and that can cause damage. That can cause blockage in your tubes.
Okay.
If you have the treatment will be to use surgery to remove them, or we give hormonal medication sometimes. But those hormones to treat endometriosis will make you not to get pregnant. Number 3, what can cause tumor blockage? Fibroids. Very rare, but possible. Fibroid, you know, I said the womb has 3 layers. The one inside, which is pink, the red one, and the brown one. Fibroids can be anywhere. It's like the wall of the house. You have the wall. There's a part of the wall that is facing your living room inside. There's a block in between, and there's part of the wall that you plate outside on the road. That wall has 3 sides. So you can put, or you can have fibroids at any part of the wall, inside, in the middle, or outside. Fibroids are when part of the muscle bulk of the womb, they just get thickened, like that thing. You see that thing, that white thing there? They get thickened. They can be thickened and so thick inside the womb wall, outside the womb, or in the womb cavity. If you have fibroids close to your tubes, they can cause tumor blockage. If you have fibroids in your womb cavity, they can cause miscarriage. If you have fibroids in the wall of your womb, they can cause pain during periods. If they are outside the womb, they can cause pain as well if they twist on themselves. So, but the treatment for fibroid is obviously surgery or medications to shrink the fibroids. But any drug we use to shrink fibroid, they will make you not to ovulate. That's the honest truth. And once we stop the medications, the fibroids can grow back. I've seen people, they've removed fibroids before. It can actually grow back, but it's not very common. But it can go back. Okay. Now, I've covered a lot regarding fertility. I know that we don't have a live audience like now, so there might not be opportunity for questions. But I will try and bring simple questions that people ask usually on our ATG page. Am I allowed to proceed?
Yes, you can, sir. Yes, you can.
So the first concern people have is that, oh, doctor, I'm having sex and the sperm seems to be pouring out. Is that the cause of my infertility? In our Yoruba people in Africa, they call it Eda or something like that. It's not a cause of infertility. If anybody in the world has sex with their wife and their wife gets up on the bed, sperm will pour down. If you like, you can hang your leg on the roof, and once you're about to walk, the sperm will come down. It's the law of God, the law of gravity. It's the law of the world. It's the law of God. It's the law of gravity. Okay, it's normal. And if you go and pee after sex, or if you go and pee tomorrow after sex, you have sex today, you pee tomorrow, sperm will still wash down from vagina. It's normal. It's not anything to worry about. The most important thing is that it's a sperm of good quality. If the sperm is of good quality, it will swim and enter the womb without delay.
Okay.
So, yes. So, getting up after sex or seeing sperm pour down in the woman vagina does not mean sperm is pouring out. Most cases, those are the bad sperm that cannot even do any job anyway. As far as the sperm is good quality, they are good quality among them, they will swim into the womb. And they will get to the womb and they'll sit down there like snipers, waiting for the egg to come, and they catch the egg and they get pregnant. Some sperm, they can live in the vagina and they can live in the womb cavity for up to 5 days. Some sperm, they are notorious. They can hang and they can wait. Just like some boys too, they want to toast a girl. They can sit down morning to night on the highway looking for that girl, and they will wait for that girl to come out of their father's gate to toast the girl. Some sperm too, they will stay. They'll be hungry. They will still stay there. They will not go. They are audacious. They will not go there. So there are some sperm like that. So if you get it's not going to cause this thing. Number 2, if you have an infection, any kind of infection, always remember that the vagina is like an open wound. The vagina has a direct connection from your outside into your womb cavity, and your womb is open into your tubes to your tummy. So you, as a woman, you must treat your vagina as an open wound. That is when I get upset whenever I hear women that they are putting all this rubbish thing they put in their vagina. Some people don't even respect their vagina. They can put Maggi, they can put salt, they can put something they call kalamata in their vagina. I see their vagina is a cookery pot. Some people even put some hot stupid things in their vagina. I see their vagina is a cookery pot. And I see people, okay, people see vagina must be treated as an open wound. If you have an infection, treat it on time. Infections not treated appropriately, not treated on time, or repeated infection increases the risk of damage to the tubes. And once the tubes are blocked, it's very difficult to unblock them. Some people they do hydrotubation to see if they can unblock you. Hydrotubation is basically we're trying to force fluid very hot fluid under high pressure to unblock the tube, like going into the vagina womb cavity and unblocking the tubes to see if it can happen. It works only 1 out of every 4 patients, and it's not reliable. Once the tubes are blocked, they are gone. It's the honest truth. Once the engine don't bafuka, you can't ring the engine. You have to buy a new engine. That is the tube. So women should protect their tubes and guide their vagina with all respect. I can't say that enough. Yeah. Another thing that women worry about is that women, they always chat with their friends. If somebody got pregnant, they're using Clomid. Somebody got pregnant, they're using Letrozole. You want to go and start gulping it down as if you are swallowing candy. Don't. You don't know their story. In fact, some women that are on Clomid, they don't even know why their doctor put them on Clomid anyway. But they go and tell your friend that Clomid, I use Clomid, they'll use Clomid too, you can get pregnant. But yeah, you use Clomid, but why did you use the Clomid? That friend will not tell you the full reason why she used Clomid, because she want to tell you all her full life history. Or some will not even know anyway. And you need to go and start swallowing Clomid and damaging your ovaries. If I saw a woman that took Clomid, even under prescription, she was from Somalia, and I saw her that time in the Liverpool area. That woman was as if she had cancer. She was almost dying. In fact, she was put on dialysis because her kidneys were knocked down. Those medications with people, they are very, very potent. They are powerful. In fact, in medical school, every medication should be treated as a poison. Poison, yes. That is to say, be careful. You must have a good reason to give anybody any medication. And if you do give them medication, you must be able to follow them up. So if you need Clomid, fine. Somebody must watch over you and do follicular tracking. Don't go and start swallowing Clomid like candy or like Panadol. Clomid is a very potent medication, and it can knock and it can destroy ovaries. And if you're put on Clomid anyway, you should have follicular tracking from day 9 of your cycle, day 9, day 11, like that, to see if your body is responding to the Clomid. And if it's not responding, we can consider increasing the dose of the Clomid in your next cycle. By the time you're using Clomid for 4 cycles, you're not getting pregnant. That means that probably Clomid is not for you. You are now tilting towards IVF territory.
Okay, sir. And so one last question. I see that you mentioning IVF, in vitro fertilization. But some of our audience may not even know what IVF is. I know you know, but some of our audience may not know what it is. So we just quickly touch on it, so they know what this IVF is saying is. Yes.
Yeah, IVF is a big thing. Basically, it's in vitro fertilization. In vitro, I is in vitro, V is in vitro, F is fertilization technology. Anything that we do that we assist in collecting sperm, put it into the womb, or putting fertilized embryo in the womb is IVF, basically to assist and to complement conception. So what we do, IVF, we can, first of all, if somebody has gotten getting pregnant, unexplained infertility, they've been trying for a long time, pregnancy is not happening, or maybe the tubes are blocked, we can't get eggs to transit the tubes to get into the womb, or maybe the person is not ovulating at all, or the sperm is not good at all, we have to do IVF. And there are a lot of things we put into consideration for doing IVF. The choice of the egg. So if you're not ovulating at all, want to get the best egg for you, want to choose a very fertile donor, and so on and so forth. So basically, sometimes what we do, the basic IVF is we're using your own egg, we're using your own sperm, your own husband's sperm. We stimulate the ovaries at some time in your cycle. We now bring you for egg retrieval. We retrieve the eggs. We tell your husband to produce sperm for us, through masturbation or whatever in the laboratory. We put the egg, sperm, fertilize, put them in the incubator, and let them work together for about 4 or 5 days, usually about 6 days. We take them out, then we implant it back into you. 2 weeks after that, we do test for pregnancy, be pregnant. Simple as that, but expensive. The medications for IVF are expensive. There's nowhere IVF in the world, but Nigeria seems to be one of the cheapest places in the world to get IVF done. In the UK, it's about 8K northwards. Nigeria is about 8K in Naira, is about 4 to 6 million Naira. In Nigeria, IVF is about 1 million to 1.5. It's relatively, at least expensive, but it's relatively cheap in Nigeria. In America, people collect loans, almost 30 grand for one IVF. People have been indebted from IVF. And the good thing about IVF as well is that we can also do other things, where we can know if this embryo is carrying some sort of genes that we don't want. So if, for example, you are AS, your fiancé husband is AS, when you want to know that the egg is SS or not before you implant it, we can do tests to know if the egg is SS before implantation. And we can even know the baby's gender before we transfer. We can check for some genetic abnormalities that are probably familial or hereditary before we transfer to know if they are there or not. And that's basically it. And we can also do egg donor, sperm donor. We can also freeze your eggs in case the IVF fails. We can use the frozen embryo to get you pregnant again, and so on and so forth. And if you are using your own egg, your own husband's sperm, IVF is about 1.1 million naira at the ATG IVF center. So so we are trying to bring the cost down. The naira is not favorable. It's always getting depreciated, and it's going to happen for as long as we live, I think. So we just try to keep our costs constant, despite the naira's inability to be stable. IVF is not the same. IVF is, I know some religious groups, they won't like IVF. I won't mention any, but some people will not even believe in it. Some people, they'll believe in IVF, but it's time to do IVF. Maybe their sperm is not good, they need sperm donor, or the egg is not good, they need egg donor. Then they start become they become no, I can't. Well, people do have blood transfusion. I agree that sperm is genetic material. It's a different thing entirely. But at the end of the day, I tell people all the time that if you need egg donor or sperm donor, it's not nothing wrong. You see, we are born by love or by nature. My father and mother, they are not related, but they have me. I'm related to them. What bond them together is love. They are one family. I'm also in their family too, and they gave it to me by genes. So we are related to each other by love or by genes. Because somebody is not your genetic relation does not mean that you can't love them and be one family. So if you need egg donor, there's nothing wrong. And some people will say maybe the person come and say is their child in future. It depends on where you get the egg donor. That's why I tell people don't collect egg donor or sperm donor from family or friends. Use commercial donor and move on. I've seen many people, they've not been able to get pregnant. They've come to me at ATG IVF Center. We have an IVF facility at Ask Gynecologists. And today, their mothers and children, they have their young children, they've moved on. Nobody wants to know how you got there. You get there anyway. And the past is gone. No matter how many times you fail and you sit an exam, the day you pass that exam, nobody will ask question. How many times did you fail the exam? It's up to you. The end justifies the means. As far as you've not done it illegally, you've done it with faith and with fear of God, and you've not hurt anyone. God can answer our prayers in many, many ways. I can tell you that for sure. And that is the life, the world we live. Let me rest a bit. Let me let you talk, then I'll continue. Let me rest a bit.
Okay, thank you very much. I feel like you've touched on a lot of things. You've touched on the causes, you've touched on treatment options, you've touched on misconceptions that people have. I don't know. I don't have any questions again, really. But okay, I wanted to touch on just one last thing. Yes, your ATG app, the ATG Foundation. I wanted to just give an audience just a short summary of what that's all about and how they can reach the foundation or the society in case they want to.
Yeah, thank you so much, Mr. Shitu. Yes, ATG. I started on November 15. It was during a difficult lifetime. It was a difficult life crisis for me, and I was finding a way to evolve and to start a new life. Basically, sometimes you get born again. Born again is inward. It's not until someone tells you you're born again because you want a new life, you want a new leaf or a new turn. I'm not talking about the church or something about a church or whatever born again people talk about. To me, that's not born again. That they don't know what. Let me leave that one. Born again is by discovering yourself, know your connection to God, and when you discover yourself, you discover God in your own way, and you call God the name that you know. When people call God different names in the Bible or in the Quran, with all due respect, those names they call God is what people discover God to be. My healer, my conqueror, my this and that. Because God, so until you discover God yourself, you don't really know God. Until you now call God the name that you knew him at your time, that is when you know God. That's when you are truly born again. Your soul communicates with God. Nobody tells you, you know you are hearing God and you know that you are convinced that God is leading you. And when God is leading us, okay, the first thing that comes is joy. You feel that joy that you are doing the right thing. You have happiness. You do something, you're not happy about it, there's no God there. That is the easiest thing that God tells that I'm here. no happiness about it, God is not there. So during that life situation, I said, like, how can I reach out to people? How can I make myself valuable to people? So I'm like, I'm a doctor, gynecology. Let me start. So I started talking on Facebook about ops and gynae. I formed this Ask Gynecology group. And so suddenly, then we're just doing question and answer, posting topics and all this thing. Suddenly, Facebook came up with this live talk, live thing on Facebook. So we jumped on it. And we started using that thing to reach out people, live talks, okay, answering questions. Then we evolved into doing seminars. Then people started to try to reach out to us. At that time, for 1 year, I'll be answering questions every night after I go back from work on email. After a while, my digits were aching me, and my eyes were aching me. I said, I can't continue this. So we started to form these premium services where people can subscribe, and I can talk with people maybe for a month or a year, whatever. So that evolved into that. Then with time, people wanted to get pregnant. Then infertility became our topic, almost 80%. Infertility. That's what people want to hear. Next thing is about fibroid, about ovarian cyst, and that and that and that. So we now said, okay, let us have a laboratory where people can do investigations and all that. So we opened a laboratory, and within a year of doing the laboratory, we opened an IVF center earlier this year because people needed IVF as well. So that's what we've been doing. To reach out to us is very easy. I can always consult with people at any time of the day as part of my week. I'm always consulting. And we can go through the ATG premium services. Our email address, you can send us an email and we will reply to you as soon as we are awake. Or my secretary, Nike, will get back to you. Our email is ATG services, SERVICES 2018 at gmail.com. Or you can send me email to my personal email, admin@gmail.com, and I'll reply to you as soon as possible. And I'll give you guidance on how to register for the services, and we can take you all along from there. And I can also send you information about the subscription as well to you after this discussion, and you can put it on for people to see if they need to. I don't know how that will work. You decide.
Yeah, I'll attach a link to the comment section.
Yeah.
So, yeah. Okay, thank you very much for
what
that.
I go through your results. If you've done results, you can do your test at any reputable laboratory. Forward it to me on my WhatsApp number. I'll review them and I'll tell you the best thing to do and how to take the best action to get your result. And if you're in Lagos, you can come to my laboratory, get your test done there. And if you need IVF, ultimately, you can also do your IVF there as well. And I'm not in Nigeria all the time. Corona has not made it very favorable, but I'm planning to go at some point this year, and I can consult with people physically. But at the ATG IVF Center, we have reputable IVF specialists there, and they consult for us consistently every day.
Okay, so thank you very much, sir. This has been a very enlightening session. To our viewers, I hope you have been able to gain as much or more than I have. Thank you very much, Dr. Babajide, for gracing our invite.
You're welcome.
Yes, sir. So, guys, so all of you out there watching, remember, if you have questions, you can just ask them in the comment section, and I will be sure to convey them to Dr. Babajide. And it will also be attaching the link to his services and his office, his website. I'm going to be attaching the link to the comment section so you can find everything you need there. Till I see you again next time, and thank you for watching our Afya Health and Lifestyle Interview Series. Have a wonderful day.